Good afternoon, sir.
Hi.
Yeah, good afternoon. So thank you so much for this opportunity. So this series is part of my HPHR project. So the project is for me, the project is titled Without Health, We Have Nothing. So during the course of my public health review fellowship, I will be doing 8 series, and I want to show more. I want to shed more light on how we can actually make healthcare the business of everyone in the country. So today we'll be talking about digital startups, and I'm very aware that you've been in the media and healthcare space for a very long time, so you are very familiar with some of these startups, and you know the state they are in now and what can actually be done differently. But before we delve into the questions, can you kind of tell us a bit about yourself?
Right. Thank you, Gabriel. I'm Dr. Laz Eze, or Dr. Laz Ude Eze, if you want to. So my full name's public health physician, health policy advocate, sustainable development consultant. I'm the founder of TalkHealthNaija, the health communications and public health information management organization. You know, and we're into improving health literacy and also, you know, ensuring that health messages get to everyone. You know, and of course, supporting health system strengthening through appropriate messaging and mobilizing citizens. I'm also the convener of Make Our Hospital Work campaigns, a citizen-led community-based advocacy to make healthcare facilities work for the Nigerian people.
All right, thank you very much for that. So can you give us a shed more light on some of the gaps we have in healthcare in Nigeria, the basic problems, those problems that are really very major problems that are actually facing our healthcare in Nigeria at the moment?
Well, the healthcare sector, there are 6 building blocks of the health system, and looking at it from each of those building blocks, we have a lot of challenges. We've made progress in the past couple of decades, but there is still a whole lot. But the most pressing problem now is the human resource for health crisis. You know, as we speak, resident doctors have been on strike. Today is day 44 that they've been on strike, you know, and there's been recurrent strike in the health sector over the past decade, different cadres of healthcare workers. A lot of healthcare workers are migrating out of the country, you know, so, and we have gross deficiency in availability of healthcare workers. So that's the biggest one at the moment.
All right, thank you very much. So now, digital startups and digital solutions we have in the country. Can you mention some of these startups and those solutions that are being provided at the moment to healthcare assets in the country?
Yeah. Yes, we're blessed. A lot of Nigerians are tech savvy, and it's one of the countries that young people are doing a lot, quite innovative. And I'm really impressed with what is being done. You know, digital startups, a lot could come to mind in terms of solutions on blood, making blood available, you know, the Life Bank, you know, that Temi Giwatuboso, Doctora, you know, so also an app to enhance access to medical doctors and healthcare services. We also have the Quickam app. Quickam app is not specific to health alone, but in emergencies, is an app that can even work without the internet. You know, so, and through that you could access emergency services. It could be emergency health, it could be fire service, it could be security agents and all that, you know, so, and that can actually be leveraged. And you also have addresses of hospitals and different businesses that people might want to utilize. Mentally aware, you know, mental health is an area that gets a lot of stigmatization and stuff like that, you know, so through that, the use of the site and the technology, much more persons could reach out to seek for support. People are getting more aware of a number of issues. So there's a whole lot of them, you know, over 20 at the last count, and really bringing solutions to the health space.
All right, thank you very much. So let's describe their impact at the moment. Can you kind of give us an insight into are they really solving those problems, and at what level are they solving those problems, the impacts at the moment? If you describe their...
Well, definitely, I think there are in enhancing access to services, and that's really important. I can't specifically, I've not done a study to measure the extent of impact, but they are definitely solving problems. Some of the problems are still there. For instance, enhancing access to blood services is still a problem, but within Lagos and some other urban areas where Life Bank is providing those services, sometimes even using drone, to make that happen, is solving problems. The mentally aware also on social media, I follow them, and I'm impressed with the response people are getting. More persons are having access to information about mental health, having people to talk to. There's also like this one, TalkHealth. TalkHealth use it on to prevent human trafficking, and also reporting cases around that. Some are used on sexual reproductive health and rights, so young people find it easier to find those they could talk to instead of getting to a health facility where they will find an older person who may probably address them in a manner they don't like, so different aspects of the health sector, and even during COVID-19 lockdown, many persons had to rely on some of these services when you can't physically meet your healthcare provider. So, Doctora and a number of them, so many of them had to utilize those services. And even those who are not like mobile applications, I know I had to, attend to some persons through virtual means and digital means, especially during the lockdown.
Thank you very much. So what are the limitations now, the problems they are having to what's preventing the uptake of these solutions among the population?
Well, the limitations, you might look at that from various perspectives. Looking at it from perhaps the provider, looking at this is perhaps a social entrepreneurship, some sort of business, so the capacity to expand. Nigeria is a very large space and with a high population, so you need to have a lot of resources to reach as many persons you may want to reach, so that's from the supply side. But the demand side, from persons who might require the services, one, do you have a smartphone? Our poverty level is rising, so even for those who have smartphone, how much are they comfortable to be able to recharge as often as they should to access the internet? There are also those who are in locations that internet services are very poor, so those who are in places that even with the app you don't have health facilities with the capacity to utilize those services that are being provided. So you have that both on the demand and the supply side. But the good thing is there are a good number of persons who are accessing this, and it's a continuous thing that there are people who have certain barriers of using internet for anything. So they just believe as long as there's no human touch, they don't quite trust any digital stuff. So those ones are there, and it requires much more information and all that. But of course, they are much of the older generation. So, but for a lot of young people, they could, get that done without much difficulty.
All right. So thank you very much for that. So now, how can we now improve on these solutions? How can we increase the uptake among the population? How can more people get to access these applications and then utilize some of these solutions so that at least we're able to improve on our healthcare in the country?
Okay, we can do that in various ways. First, we need a stakeholders engagement. Mostly it's the Ministry of Digital Economy and Communications that tend to be concerned about most things that are related to technology. But I'm glad that some organizations like Nigeria Health Watch, APR Freak, have been doing health tech stuff for a while to try to gather folks with innovations in the health sector. So the Federal Ministry of Health needs to harness this technology and also have a meeting with the critical stakeholders to understand better what they brought to the table and how they could be supported. There should be grants available to those of them that require more funding and equity to expand. And of course, it could be grants or in form of low interest loans to encourage them. So in medical science teaching, medical curriculum, so we need to update it. This 21st century is a period of technology, so we need to begin to empower medical students with skills, or health science students with skills and capacities to be able to know the roles that technology could play, in medical care. So various ways of identifying some low-hanging fruits, and getting them sorted.
So thank you very much for your time.
All right.
That'll be all. Thank you.
All right. Thank you.
Bye.